possibly we'll have to come back for amendments tomorrow, but we'll see where we're at. We're working on it. That's why the computer went down.
Oh, awesome.
We dropped the temperature and the computer went off.
Go with that, sorry.
I think we're gonna look into this IT thing.
Recording in progress.
It's okay. We're back from recess at this time, and the first one up will be Julie Mayber with child support, which starts on 337.
Hi. All right.
Okay,
Thank you.
thank you for coming.
I'm Julie Mabry from Child Support. Thank you all so much for having me here today.
You'll have to get closer to your mic if you would,
Oh,
please.
yep, absolutely.
Thank you.
Sure. I haven't really been keeping track, but I believe this is about my fourth budget cycle or so, so I'm not exactly what I would consider experienced, but I'm not as new as some of the others that were before me today as well. Child support is a federally required program, and so therefore my portion of the budget is reimbursed at 66% of our final gross expenses, making my budget usually relatively boring, which could be a good thing at this point in the game, I suppose, for all of us. A couple of things that I just will point out here from some of the highlights is that my department did receive the Outstanding Achievement Award in 2021, which means that we met all of our 4 performance measures for the state, which means we're going to be receiving 100% of our performance measures in 2023. So that also had an impact on some of our revenue that's coming in, and that's where that went up a little bit, along with some additional expenses. The more expenses that I have, the more funding we receive back in as well. So that is kind of where that came from. Other things to point out, I did eliminate one FTE that was an administrative associate position. I just couldn't justify saying that we needed to refill it at this time. I think since COVID hit, our walk-in traffic has really decreased a lot, and we were able to absorb that amongst the rest of the clerk positions in my department. We do have 4, so they're able to kind of cover that front walk-ins as needed. So at this point in time, I was comfortable saying we could eliminate that position.
Sorry, Julie, but you're going to have to talk louder. They can't hear you in the back.
Oh, I'm so sorry. I was just saying, I don't know how much you missed. You're okay? Okay. Okay. Let's see here. I was able to meet the county target or levy target that I was given from county executive, which remained the same from last year as well. Within my budget, I think a lot of that was just looking at some trends a lot closer and sort of just trying to really hit that target with some, looking at different intentions and different trends that we have been having in my department. So, any questions on anything? No?
Supervisor Eisen.
Thank you, Mr. Chairman. Julie, could you share with us from page 337 your accomplishment of the Outstanding Achievement Award for 2021 fiscal year? Who is that from and what's it all about?
Sure, absolutely. So the state funds, we have performance measures. So if we hit these achievements, we get certain percentage of our performance hit. There's 4 different categories that we're basically judged on. And in 2021, we hit all 4 of our measures, 100% of what the state standard requests us to meet. So it's establishing court orders for cases, establishing paternity for cases, ensuring that current support is paid, and also ensuring that there's a certain percentage of arrears that is paid every year.
What organization was that?
From the state? It
That-
comes from the state of Wisconsin?
From the state of Wisconsin.
Like the, like Department of Children and Families.
Wow. Congratulations.
Thank you.
I don't see any other lights, so I thank you very much and congratulations on your reward.
Thank you.
Next up is Veterans, Commissioner Jeff Buckles. That starts on page 345.
Put it up a little higher. Good afternoon, everyone. My name is Jeff Buchholz. I'm the County Veteran Service Officer. Unlike my predecessors, my other colleagues that went before me, we are 100% staff currently right now, so that's a good thing. We did have some staff turnover. One of our long-tenured staff members, some of you may have known her, Judy Steckbauer, she retired earlier this year. And Lydia Wills was promoted to her position. We did have one staff member that left due to a higher paying job. But we have filled those 2 slots. So we're in the process of training those up right now. Currently, we have myself, Lydia as the deputy. We have 4 benefit specialists and an admin person. So we're a smaller department. I just want to draw your attention to we do not have a lot of significant changes this year. We do have, due to that staff turnover I just talked about, we do have some savings there with wages and elections of health benefits. But for the most part, that stayed the same. I just want to highlight one thing. Under that operating grants there, we did not lose that grant from the state, just to be clear on that. We're still receiving that funding. It's a matter of how it shows up on our budget. Years past, we've always had a separate line item expense for that grant and how we distribute it. This year, we're eliminating that line item and we're just plugging in the grant monies targeted to what programs that we're going to use those grant monies on. Instead of trying to fill it after the fact, we're just going to plug it in on our budget where we think we're going to use those grant monies and go from there and hope we're spot on with that. So we did not lose that grant, so please don't think we lost that grant. Other than that, we have no other changes. We're not removing any staff. We're not adding any staff. It's a pretty standard budget. This is my 4th budget, and I think I got to tweak just where I want it to go. As far as a couple things I'd like to highlight this year, we really focused on outreach, getting back out in the communities, especially the rural communities like Winnebago and Omro. We're trying to get out of our fortress in Oshkosh and branch out to the rural communities. Due to COVID, it seems like traffic coming into the office is a little less, so we're trying to get out to the rural communities to meet them at their where they feel comfortable. So this year is going to be a really tough year for us because of President Biden signed into law the PACT Act, which has really opened up the door to a whole plethora of benefits that are available to veterans, and we're definitely feeling it right now. Lots of phone calls, lots of walk-in traffic. It's been pretty busy in our office. So I think this year will be a test of how we can keep up with last-minute law changes. So at this point, I'll open it up to any questions anybody might have.
Supervisor Norton.
What do you find are the greatest needs of veterans nowadays, currently, and how can this county and our affiliates that we work with best address those needs?
You know, boy, Supervisor Norton, I wish I could give you one specific thing, but it's a bunch of things. Depending on the demographic of the veteran, you know, we have World War II, Korean era veterans that are now in need of assisted living homes and nursing home care, and there's programs available to the VA to help fund some of those expenses. There's a lot of fellows, veterans that are getting ready to retire from the workforce, and they're looking at different ways to supplement their Medicare plan, you know, through VA healthcare. So it really depends on the demographic of the person. Our office focuses a lot on disability claims and pension claims. Disability, we have a lot of our Iraq and Afghanistan veterans coming back with issues from burn pits and different exposures over there. So that takes up a lot of our focus. So I can't just pigeonhole us into one specific thing, because it's everything from healthcare to aging to younger guys just getting back from Iraq and Afghanistan. I hope that answers your question.
Just a follow-up, did your office help veterans who are in need of finding employment and/or to start a small business?
We're fortunate that we have a pretty good relationship with workforce development. The Department of Workforce Development has specific, we call them DVOPs. I don't know what that acronym stands for, but they're specific to help with veterans find employment. And we've allowed them to come and use our office space, so we're trying to make it a one-stop shop so they can come and meet with that DVOP one-on-one to help find employment. So that's one thing that we're doing as far as employment. I forgot the second part to that. I'm sorry. What was the second part of that question?
Got myself.
Sorry.
Supervisor Nelson.
Oh, okay. Small Business Administration, oh boy. You know, we don't have a lot of involvement with that. There's specific grants and there's some programs through vocational rehab that help with that. But the Small Business Administration has a particular office that works with veterans to start businesses. But I can't, our office specifically, we don't help with business startup. Hope that answers your question.
Supervisor Nelson.
Yeah, just wanted to echo your sentiments. Commander of the Legion Post in Winnebago, and it is refreshing to see one of your people there once every Thursday, once a month, and it seems to be kind of a steady line of people coming in waiting to talk to them, and I think you are definitely reaching a bunch of people that thought they were kind of forgotten. So just want to thank you for that.
Yeah, our Winnebago has been that's been a, I don't want to say a gold mine, but it's definitely been something that I was like, wow. Every time we go there, we're helping people right on the spot there. It's so nice. So we're going to continue with that for sure at your post. Thanks for that, by the way. It's a,
Vice Chairman Fari.
Thank you, Mr. Chairman. I'd like to refer to housing for our veterans. Obviously, we don't know if some of them are homeless, but what are the housing needs for veterans?
so
Permanent housing needs.
permanent housing. What we're experiencing is, so if we have a homeless situation with a veteran, like we did last winter, we had a real bad spell where we had several homeless veterans. And there's resources there with security deposits and first month's rent and things like that. However, it's finding the location. There's nothing nowadays. You just can't find an apartment just like that. A transitional housing piece would be helpful because some of these people that are homeless or they have evictions on their record or maybe they don't have established credit history. And that makes it hard because these landlords can be really picky now. And it's almost impossible to place a veteran that's had any type of history, negative history, find them a home. So we have the resources financially to help them, but it's finding the place that we do not have. If we had some sort of something here in the county, that would be such a blessing for us. where we, even if it's a temporary thing, where we could stick them there for a couple years until they get their credit history built back up and they're back on their feet. That would be helpful. A permanent spot would also be helpful, some sort of permanent housing situation for them. There's a need, if that answers your question. It's
Is
definitely.
it, well, let's qualify the need. Is it substantial? I mean, you mentioned veterans are getting older, they're retiring, et cetera. So I assume when they get to that point in life, depending on what they've done, there might be a need for at least subsidized housing or something to that extent? I mean, are we talking a lot of veterans, or a few veterans, isolated cases?
If I had a 20, let's say a 30-unit property, I would fill it relatively quick. Just because once they know it's a veteran spot, they're going to flock to it. They're going to want to go there, especially if it's subsidized in any way. Much like the Veterans Village out in Outagamie County, they have a specific.
Actually, that's my comparison. I
Yeah.
wasn't going to bring it up directly.
We
but
would
yes.
love to have something like that here, but it's a tough.
Very good, thank you.
Supervisor Challenger.
Thank you, Mr. Chairman. I'd like to ask a little bit about the piece of legislation. I forget what you said it was called. Were you able to forecast and think about the benefits that you were going to connect people with under that program when you built this budget?
No, to be honest with you, sir, Supervisor, I did not. We did not know all the details as much as we did. And for example, I don't want to get too deep in the weeds here, but there are some things that I was absolutely not expecting. I knew the burn pits and things around there, but there were some things that I absolutely was not expecting to be a part of that legislation that has really changed things, especially for your Vietnam era veterans. So.
I think, I don't know very much about it, and certainly it sounds like there's still, that it's a very robust program, and everything that I've heard kind of just, mirrors that. So I think my question would be, do you see a bigger burden, like that your bigger than what your team can handle with this, or do we need to, do you have forecasts that might say if you had a project, a limited term employee to help with this, or do you, I just don't know kind of the length of time or what's going to go into making sure that our people can get connected with this. But I want to ask that question to you to make sure that in the information that has evolved since you put this budget together until now, that this board has a chance to be reflexive to that and give you the things that you need to do best by our people.
I would have to say, to be brutally honest, right now we feel a bit overwhelmed. Okay, but part of that is we have two newer staff members that are just finished up accreditation training. They're not even fully accredited yet, so it'd be tough for me to say we won't be able to handle it because right now we feel it, but those two new staff members are going to help us significantly down the line. It's just right now we're feeling a little bit of the crunch. And looking back a year prior to the last budget, I did eliminate a position, and I'm kind of second guessing my decision now. But it is what it is. I mean, once we get these two new staff members, I'd like to assess where we're at and see where we go from here. I think this year would be a tough. It's tough to gauge that because of the two new staff members. So.
Okay. Well, we have a few hours before we're going to go to amendments. So if something changes or you want to take some time to think about how that's going to impact your department, certainly the door isn't closed, but this is the easiest time for this board to help you. Thank you very much.
Thank you. I appreciate the concern.
Supervisor Swan.
Mr. Buckles, I want to personally thank you and your department. I was a child caregiver for my father, a World War II naval veteran for 3 years, and you really do act as an advocate for the veterans. Can you explain a little bit, maybe, I know through the special pension program, the paperwork is just enormous to get approval for that, and you helped me through that process. Just a tremendous amount of help, and I'm not so sure that people are that aware of the fact that the County Veterans Services Office is really an advocate for the veterans and the maze of paperwork that has to be completed with Milwaukee or with National.
There is quite a bit that goes into these applications. Pension is one of them. That application has evolved into something way more than it was a few years ago. And it's a tough program. If there's, I hope there's no any lawyers in here, but it's a tough program if lawyers are jumping on it because they're charging people to do what we do in our office for free. So
Yeah.
that tells you that the average person that's not familiar with the applications are not used to it.
Yeah.
If it was that easy, the lawyers would not be making money off people. So we do it for free. So please
Yeah,
spread the word.
And you do a good job. You really
And we
do.
have access to all the computer systems. We have the accreditations. We can literally log right into their system and see what they're doing real time. And as soon as we see a problem, we can jump on them and correct it before it becomes an issue.
That's
So,
right. Thank you.
Thank you.
Supervisor DeSero.
Thank you, Mr. Buckles. Am I saying that right? Last name?
It's Buchholz, but
Buchholz, okay. So thank
I've
you
been
so
called
much.
a lot.
I was just wondering if you're familiar with the services, the housing services through AdvoCap for the veterans?
We use AvoCap for their ride program. Is there housing, like?
Yes, and I'll go ahead and reach out to you afterwards and try to fill you in on that too, but go ahead.
The financial piece, are you talking a financial piece to help with or is there something else that I'm missing?
To obtain housing, they have various programs. It's a catch-all
Okay.
type of organization. Okay, so my second question is, with the PACT Act, is there anything that you're seeing that what I'm hearing you say is that there's just a lot going on because of that policy? Can
I elaborate?
yes, please.
Okay, so it's touching on multiple eras of veterans. So you have your Gulf War era veterans, the Iraq and Afghanistan. There's cancers and there's presumptive conditions from exposures in those countries, burn pits, sand, particles, different things. So there's new things benefits that are available to them. But it also impacted the Vietnam era veterans. And the Camp Lejeune, you're probably hearing the commercials on the radio and the TV, the Camp Lejeune. There's some programs that impacted Camp Lejeune down in the Marine, which is a Marine Corps base. So Vietnam era veterans, particularly there was only benefits that were applicable to veterans that went in country to Vietnam, or if they were in the Navy in the shoreline there. But now that there's certain benefits that are available to people that served in Guam and Thailand. Thailand veterans have been denied benefits for years, and it's so frustrating because it borders Vietnam, but they were been denied the same benefits that a Vietnam veteran did. So now that those barriers are gone, it's just been a flood.
So just one follow-up comment. Thank you for all you do. You're doing a lot with $590,000 in it. We really appreciate it. You've helped me personally, and keep up the great work. Thank you.
Thank you.
Supervisor Robinson.
Thank you, Mr. Chairman. I just want to bring this up, Jeff, because I think it's very important. Fox Valley Veterans Council, I don't know if you all are aware of this, but last year, Jeff working with the council, they dumped over $50,000 for helping out veterans right here in Winnebago County.
Yes, it's a great partnership. So we work together with them. It's a nonprofit for those that aren't aware, and they provide financial. That's why I was back to the question about the housing. There's some financial resources there that we can tap into. It's finding a location. That's the struggle for us. So, thank you.
Supervisor Powers.
Thank you, Mr. Chairman. Mr. Buchholz, this may be an obvious question, but not to me, or an answer. When you say support veterans and their dependents, is that surviving dependents as well?
Correct. So we actually help quite a lot of widows.
And what if they're young children?
It depends. Typically benefits for dependent children, well, we're going to get deep in the weeds here, but so it's age 23 for some benefits, 26 for other benefits, and then there's some if they're a disabled child before the age of 18, there's benefits that last their lifetime, and there's, I'm not going to use names, but there's children in assisted living homes and nursing homes that we support through survivor benefits.
Thank you.
So,
Supervisor Hens.
Thank you, Mr. Chairman. I just want to say, as somebody who both served and has used VA services myself and has had to advocate for a father who passed away in 2008, and start using you guys to help advocate because of proving that it was caused by his in-country service in Vietnam, the upward trend of the way you take care, your office takes care of people, has been so significant in that time period since 2008. Because I remember when we first started out, it was difficult to get help. And I believe it was Joe Aulick, I think that was here, and he totally changed the way our county VA services were done. And it has carried on through everybody since he's been here, I think he's up in Brown County now. But you guys do a phenomenal job trying to help people out. I don't necessarily come down there myself to get things done, but I do hear from other veterans. So what if like Supervisor Schallinger said, if you guys think you're going to feel the pinch, today is the day to talk about it, because you're going to have advocates here that support you in what you do, because we've seen, a lot of us have seen firsthand the job that you guys do. So thank you very much for that.
I appreciate those comments, and I'm going to toot my own horn here, but I shouldn't say my own horn. It's actually our county, all of you, all of the veterans here in the county. I'm so proud of this county and our veteran population. The county board has been very generous to us over the years. When I look to my other colleagues and around the state, you know, there's very few counties that match us as far as manning, and there might be some others that have bigger budgets and things like that. But the manning piece is key. When I say manning, I meant staffing piece is key, because that allows us to provide customer service that really the people in Winnebago and the veterans deserve. So I'm very proud of the fact that our county board has been so supportive of us over the years, and our veteran organizations, American Legion, the VFW, the DAV, we all work together to help each other out and help the veterans and their widows, their children out, and it's an amazing thing to see from the top, and I appreciate the comments. Thank you.
Supervisor Bender.
You said it's hard to find a piece of land to build like a veterans community on. I know where the tiny houses are being built right now. Just across the street, there's like 9 acres of land being sold, and I would think that would be a decent site for a veterans village, close to the bus line. Do we have any grant money that would be available for something like that, or?
That's a big project, sir. Now, the county exec this is hot on his, I'm not trying to, this is a hot topic with him. He really wants to find something bad here. So we're looking at maybe purchasing some properties. There is some land out by Parkview. So it is, it's definitely something we want bad here. So if you look, I haven't been asked for much money here the last several years, but the time's coming. Where I'll be asking for something here shortly.
Yeah, I think that would be a nice parcel, and maybe it would be something that you could look at. They're asking $750,000, but it's actually been for sale for about 4 or 5 years. So I know the last person there passed away, and the kids have it. Might be able to get it for $400,000 or $500,000, you know. And it's like 9 acres, so I would think it would be where the kids' village is. I think is only like 3.5 acres, so it would be considerably larger, and you know, someplace to start a project where you would have to find grant money maybe to complete it, but maybe, you know, through ARPA funding or something like that, we could get the money to get the land.
Thank you.
Supervisor Ellenberger.
Thank you, Chairman. Director, I'm just going to say Jeffrey because I'm never going to get your name out. So Question, I'm going to piggyback on what Supervisor Bender was talking about. I know that in the Neenah area in particular, that there's going to be some elementary schools that are going to come on the market. We've already talked about that, you're looking.
Oh,
But,
it just sold.
I'm not, no, there's more.
Oh, is
There's
there
gonna be
really? Oh,
more.
okay.
Yep, they're doing
Yeah.
a complete, yeah, they did a facility study. They're actually, because of the movement of fifth grade going into the middle schools and so forth, and coming out of the elementaries, they're gonna be doing probably at least 1 to 2 other elementary schools. I just wanted to let you know so that maybe perhaps you could get in touch with them, because that would be probably a somewhat easy transition. Because I'm assuming you're looking for about 50 to 60 rooms or so.
That is the ideal situation, is we find a facility that's already built and has the property, and it's a matter of just converting it over, rehabbing it through nonprofits to assist in that app.
Right,
So-
there's a lot of
and
pieces
it's not
moving
the-
there,
it's
just
not-
so you might want to get
Yeah.
in touch with one of them.
We have people looking at this constantly, so,
I was on the school board for 12 years, so I know for sure that there's more coming.
yeah. I was specifically talking about the Roosevelt,
Right, that one went fast,
yeah,
to a all-cash bid.
yeah. So, that's unfortunate, situations like that, we gotta be able to move like lickety-split.
You might want to get in touch
Yeah.
with the other people at the board then.
I appreciate that.
Supervisor Robinson.
Thank you, Mr. Chairman. I just wanted to bring up, Jeff, also, I don't know if this is part of your crew or not, but, you know, the Green Bay Vet Center, they have counseling for, they have groups there that meet at his office and on a monthly basis, and it's pretty cool. It's a PTSD groups and different other groups. Is that not right, Jeff?
Correct. So the Green Bay Vet Center, they're out of Green Bay. Instead of having our veterans go up to Green Bay for counseling and group sessions, we have an agreement with the counselors and the organization. Where if we provide the space, they'll meet our Oshkosh and, you know, our Winnebago veterans right here in Oshkosh. So it saves them from traveling, you know, to Green Bay and Appleton for counseling when they can get it right here in the area. So that is another great partnership we have. So.
Very good. I see no other lights, and I thank you very much.
Thanks. I appreciate everybody's time and questions, and I do. I appreciate it. Thank you.
Next is Human Services with Dr. Bill Topol. That starts on page 357.
Hello, good afternoon. Bill Topol from Human Services. I think all of you know me. Today with me is Janet, our Administrative Division Manager. She and her staff really helped greatly to put together our budget, which you can see is about 50 pages long. So I'm going to try to be very brief and allow you to ask questions so that we're not here all night. All right, so let's go. So my division, or my department, is about 300 people, full-time and part-time. Our budget this coming year will be just shy of $48 million total, of which about $18 million is levy. So where do the other two-thirds come from? Basically comes from federal and state and third-party resources that we collect throughout the year. What is our mandate? It's a state mandate. The state directs us through their contracts to do a variety of different human services functions throughout the year. We perform 60,000 plus cases, ranging from child abuse, neglect, to mental health, substance abuse, crisis counseling, long-term support for kids and adults who have disabilities. We do an Aging and Disability Resource Center to help provide information to families who need that. And we also do a variety of unique things here that aren't part of our mandate, but have really been a big success since I've been here 15 years ago. One of those being the Connect program, which we didn't used to call the Connect program, but now is called that. Basically, it's all of our diversion programs for people who have a substance use issue, a mental health disorder, or some kind of need other than legal. They've gotten involved in the legal system, but they're able to be diverted. And this came about through the judges and through our former district attorney, seeing the need to try to divert people from the legal system when they had other issues that could be dealt with, and get them on the road to recovery. So that program has now blossomed into, as an umbrella, over 500 people are currently in those programs. Drug court, Safe Streets Initiative, 24/7 alcohol, which is, monitoring people who have had alcohol issues, 24/7 drug, teen court, and a variety of other programs pre-sentencing and possibly post-sentencing as well. So it's been a big success. That program actually came before you probably about 4 or 5 years ago as to get that kicked off, and so here we are today. It's a success. Another program that we just started this year is a drop-in center for folks in Oshkosh who are recovering from severe mental illness or substance use issues. They have a place to go during the day. And through actually our county executive offered part of our State Street building, which is part of the county administration building, they have a place to go. And we've had 20 to 25 people every single day use that facility. And where were they going before? They were walking the streets, they were probably at the library, they were maybe huddled up in a warm place during the day. Now they can come in and receive some support and maybe a little food and drink, and get some of their needs met, and we can keep an eye on them better and help them before things get worse. So that's going well. Later this month, I'm coming before you for the sale of shelter care to help our kids have a place to go in our child welfare system. So you'll hear about that later. I'm not going to mention that anymore. And I wanted to let you know, we were kind of talking about achievements. Mr. Isa was talking about achievements before. One of the things I'm very proud of is our staff got a NACO Achievement Award in 2019 for excellence in service around child welfare and keeping kids and families together safely. And we actually have one of the best records in the state, for keeping our kids and families together, for reducing, placement costs. We're very proud of that. And it all goes to my staff. If, it isn't this guy up here talking to you about it. Yes, I lead the ship, but it's really those 300 or so folks that are dedicated, absolutely dedicated to helping the people in this community to really get what they need and to help them every day. And I'm very proud of them, very proud of the work that we do, and that's all I'm going to say right now. So please, give me your questions or ask me anything you'd like.
Supervisor Defferding.
Thank you, Mr. Chair. And this is just a quick comment to the board, too. If you want to get some of the numbers in regards to the Winnebago County Connect, do come to the Safe Streets meeting. That's where we actually get into the nuts and bolts of that. So just wanted to pass that on to the board. But a quick question to you, and this is something that we spoke about before. I just wanted you to kind of inform the board a little bit more as well. I know that you're working with the city of Oshkosh in regards to having perhaps a team of first responders for those with mental health conditions. If you could tell me a little bit more, or tell the board a little bit more about what that is, how that's coming along.
Sure. It's a popular program now with area police departments and sheriff's departments around the state of Wisconsin and around the country. The idea is that they have an officer at the police or sheriff's department that's dedicated to more of a role that's community focused, a role that's maybe more intervening in a non-threatening way to individuals who are experiencing mental health or substance use. So they have an officer, and then a county or a city may employ a social worker who is working in tandem with that officer, and they may go in and may do well person checks. They may intervene in crisis situations to try to de-escalate. And we just started a program this year in April with the city. The city is paying 50% of the cost of the social worker. Another 25% is coming from some extra funding that we had, and 25% is coming from levy. And this is an experiment. We are seeing whether or not, over the course of this year, whether or not the impact that that team is making is greater than the services that we provided earlier, which is we've always provided crisis services to the police department. If they request us to come, we are always going to be there, hopefully within 15 to 30 minutes, and address the situation on the spot. But this program is more what's called a co-responder model, and we're just trying it out. And I heard from Supervisor Defferding that perhaps the Sheriff's Department, perhaps other local police departments might want to get involved in that. And as soon as I get the actual data and determine whether or not it's really the best way to go, once we determine that, if that's possible, I'd be glad to sit down and talk with any department about how we go about structuring that, you know, in the years to come.
And that's something I certainly want to look into for 2024. Once we get that data from the city of Oshkosh and figure out efficiencies and inefficiencies, what we can do better. Yeah, I did receive an email from a county resident literally just yesterday of a story of a friend's brother who has mental health conditions. That had called 911 14 times. A regular officer responded instead of a behavioral health officer. It ended up with 4 charges, and this person is incarcerated. So I definitely think there is a need for the county, and we should take a look into that. Again, looking into 2024, though.
Supervisor Norton.
Thank you. I want to ask you about, I believe it would be the Rural Transportation Program, or specifically the Route 10 program, which was cut, I believe, from your budget. That, for people who don't know, was a route that hooked up people from Oshkosh to Neenah. I guess my question, where would I have found that? And B, what is going to be its replacement, or, yeah, that's my 2 questions.
Okay, so Route 10 is a bus route that the city essentially funds that goes from City of Oshkosh to Neenah and back, and helps with transporting folks that don't have a ride to get up to Neenah. Maybe they connect then up to Valley Transit for economic development purposes. Maybe they're going to a job. Sometimes there's a disabled person that uses that, and that was our piece. Was because we have some funds for elderly and disabled folks that might need special transportation needs. So our part in that was kind of a smaller part in the Route 10. The decision was to look for something different than Route 10, not to completely eliminate it, but to come up with something called paratransit, which is the idea that maybe instead of a bus, maybe that's not full and you're not utilizing it the best, maybe it would be a smaller transport situation, maybe more efficient. And my understanding is in a week or two, East Central Planning and the city and the county are going to sit down and talk about what's the next vision for that. And there is some money still available, for that paratransit.
Okay. My second question, could you tell me the status of the HELP program? And just the editorial, I thought, Mr. McCollar or anyone, Mr. Chairman, I thought this board was to get a update every 6 months about the neighborhood improvement grant funding, which was part of that. So you can answer the question about the HELP program, and I guess I would like, this whole board would like to have a update on the neighborhood improvement grant funding.
Go first, or want me to go first?
Why don't you go ahead about that?
Okay, so I'll talk about the human services piece of the Neighborhood Investment Fund, which was about a $10 million grant. Our piece of that was roughly $800,000 or $900,000, and our piece is basically to develop a information and referral service based on our Aging and Disability Resource Center model to try to help people who have not yet lost their home, not yet lost their apartment, and to try to aid them in providing them information and support and assistance to get the help that they need so that they don't lose their home, so they don't lose their apartment. So it's our HELP program is to basically avoid eviction, avoid foreclosure. And we are basically in the very early stages, and we have hired the supervisor for that program, and it's probably going to take them the rest of this year to get up to speed, and then we're going to hit it hard come 2024. and hopefully we're going to, hopefully we're going to have some good statistics for you next October.
Well, and regarding the Neighborhood Improvement Fund grant, our efforts lately have been to try to get the grant agreement finalized with the state. So I believe, Mary Ann could correct me if I'm wrong, but I believe either Thursday or Friday, the state indicated that they believe now the grant agreement was ready to be signed. So it has not fully been executed yet by the county or the state as far as I know, but it should be ready to. We've had a very, frankly, frustrating process working out this agreement with the state. The one we originally submitted for approval, they rejected, saying it had too much information. Then they changed their story about 3 times about what they wanted included in that, and we ended up with something not too far probably from where we started out with. So unfortunately, we've had a delay caused by that. We can't process anything further. On the other hand, we have been in communication with all of the subrecipients. We have 6 subrecipients of that grant, in addition to a portion of the grant that will pay for the HELP program. And in order to do a draw request, we have to have the agreement signed, but we have been in touch with them, let them know the status, and have collected information about what we'll be able to make as our first draw request. Under this grant, we're not just given the $10.3 million. We have to present information about how it's been spent or how it is going to be spent in the next 6 months, and then we can make a draw request for those specific amounts. So if I were here at the budget hearing, I'd probably be working on putting together that draw request because I have most of that information from the subs. And as soon as the agreement is signed, the main agreement is signed by the state, then we intend to submit that draw request because several of those projects are well underway. And I don't know the exact status of all of them. I've been focused on the grant agreement and the draw request, but several of them are in process. Are being funded through short-term loans in some cases because the money isn't available yet from the state. So they're very, very anxious to get that squared away, but it does appear that all 6 or 7 projects are well on track to be completed in fairly short order.
Well, gotta wait your turn. You haven't called in, just hold on. Supervisor Zelmer.
Thank you, Mr. Chairman. Two-part question, Bill.
Sure.
How rampant is child abuse in our county? And are there programs for parents with newborns on how to raise them so that they can stay in a safe environment?
Sure. How rampant is it? There's about 3,000 calls that we get a year from people who are concerned. When we actually boil it down to when we investigate those and we really see who has committed some act, it really is in a few hundred number of folks that do that. Our goal doesn't end though, like with making sure that the kids are safe isn't the only responsibility. We have an obligation to try to work with the families to correct some of the things that got them there in the first place, right? To help them with maybe they've got a substance use issue, maybe they've got a mental health issue, maybe they've got other things that they need to address. So just because we remove a child, even briefly, we still work very hard to try to resolve the situation and to try to return the kids whenever possible. And so I think in terms of proportion, to finish up the question, I think in terms of proportion, we do better than the average county in terms of fewer numbers. I think that's because we have a very active program. The home visitor program for newborns, which is more run through the health department than through us, has been a very important program to meet with new parents, shortly after they've been at the hospital or even while they're at the hospital, talk to them about resources, share information, because we know that parenting doesn't come with a manual, and not everybody's ready to be a parent, and not everybody had good parenting. So we recognize that, and we really want to be able to, reach out to them and help them however we can.
Thank you.
Supervisor Estero.
Thank you, Mr. Chairman, and thank you for your presentation and for 15 years. Sure. Thank you for your 15 years of service. So I just have several quick questions, hopefully. I'm looking at 42106, children's waiver, and I'm just wondering, I'll turn,
42,
I think it's 360, page 364, maybe?
364, okay.
Yeah.
And are we talking about a revenue or expense?
Expense.
Okay.
So my question is.
That's revenue. Apparently, I'm being told that's revenue, not expense.
Okay, that takes care of that one. Okay, so, and then 42192, maybe these are all revenue. Page 365, the nutritional congregation, nutritional something.
Yes, nutritional meals, congregate care, Older Americans Act, we're act as a pass-through from the feds. That's revenue.
Okay, and then,
Anything starting with a 4 is a revenue account. Anything starting with a 5 is an expense account.
okay, thank you.
Thank you, Mike.
Page 371, 54020, maintenance, is that for the shelter?
Yes.
Okay. So we haven't approved it, but it's still in there? Is that, we haven't approved the shelter, but that amount is appropriated?
Because at the current time, we're running it with part of our crew and part of another, we are operating it currently. So
Okay.
we do have maintenance
Okay, thank you.
requirements.
Sounds good.
Yeah.
And then my final question is page 373, 55070, secure juvenile detention. Is that our current expenditures or our future? The secure juvenile?
Could you say the number again, please?
Sure. 55070.
Yes. So secure detention is our best guess of how many kids are going to need to be placed in secure detention. Secure detention is a juvenile, essentially a juvenile jail facility when kids have to have a secure placement. Currently, we have a large contract with Fond du Lac, and when Fond du Lac is full, we have to use other counties for that. And so we're just our best guess of what we're going to
Okay.
spend next year.
So just my concern or question, and this is it, is the institutionalizing, are we trying anything, that part of institutionalizing young people is a concern.
Sure.
But I'm sure we can talk about that later on.
Yeah, so the institutionalization of kids, we know from all of our research of the last 4 decades that institutionalization of kids does not usually yield them changing their behavior or having an epiphany and changing those things about. The secure detention budget that you're looking at, these are kids that are there on average 3 days, maybe a week, and only a few times are they there longer than that. So this is a very short-term placement. This is not a long-term care line. But we really try to avoid placements whenever possible.
Supervisor Cox.
Thank you, Mr. Chair. Thank you, Mr. Chairman. Mike Collier, could you please get back on the network investment grant and tell us how that amendment on the bottom of the 303 resolution is going to be handled with the presentations? That would be every 6 months? Okay? How are we, is it going to be presented to the board, and when will it start? Because we're already beyond the 6 months for starting them. And this concerns Dr. Topol in that he is part of that presentation.
Yeah, we can certainly arrange for a presentation after the contract is signed and the draw request is submitted.
Is it starting when the contract gets signed, or is it starting, the timeline is what I'm saying?
It's been a while since I looked at that resolution. I'm sorry, I haven't thought that through very carefully, but I have no objection bringing that to, bringing a presentation to the board in the next month or two, given where we are once we have the contract signed.
Thank you.
Supervisor Schellinger.
Thank you, Mr. Chairman. I would like to just ask about how your employees, how you've been managing. You obviously have the largest group, and specifically thinking about what is turnover looking like for you? How are you able to fill those positions? And are there any deficiencies, services that we're giving up because of that?
Sure. The average turnover at any time, including this week, is about 5% of my staff. So 5% represents about 15 openings. In the early part of this year, I had as high as 30 openings in January and into February, partly because COVID, if you remember back, there was kind of a surge in COVID in January, and a number of my staff unfortunately got it and were exposed to it, and so we had a lot of people missing. A number of people decided, to either work from home permanently, as in maybe I don't want to, work in this environment anymore, to other people leaving for other counties. Our closest neighbor to the north is the county that usually ends up with the bulk of people who are looking for work elsewhere. So on average, we're probably about 15 people down at any one time. I think I tracked over the course of the last 5 years, 50% of my staff have turned over. That's pretty significant. I can tell you the areas where we're finding the biggest challenge is in the area where we have competition from the private sector. Those being social workers. It seems like, there wouldn't be a great demand, but there is in hospital settings, in nursing homes, in schools, you name it. Social workers are in very high demand, and they're all competing. We're all competing for the same person. The other two areas are mental health professionals who are skilled, have a few years of experience, and are fully licensed. We're having a very hard time finding them for the same reasons. They can work in a variety of different settings. And the other area is substance use professionals, people who are trained, licensed, and have some experience in substance use disorders and treatment. So those are my three areas where I have the hardest time recruiting. What are we doing? I'm anxious to see what the pay study reveals. Any ideas, I frequently hear about ideas that our neighbors to the north are using. They're using some incentive programs that we don't use. They're offering some tuition reimbursement that we don't have. They have a little bit better vacation schedule than we do, and their pay is slightly better. So with all those things considered, if you had a choice between working for Winnebago County and our neighbors to the north, all things being equal, where would you work? So I think we all know the answer to that. I think that's the challenge for us is, to really keep up, with where the trends are right now. And I think hopefully the pay study will reveal what it is that we all need to do to try to address that, not just for human services. Parkview for sure has got challenges. The Sheriff's Department has got challenges. We have an operation that's 24/7. One of our big challenges is to find people who want to work overnight, third shift. We currently don't have differential pay for third shift. We don't offer an enhanced amount of money for that, for doing that work. And I think those are things that we need to really focus in on, all of the tricks, all of the ideas that we can muster. We do have a very good culture. We do have a supportive culture. We do try to provide people with alternative work schedules if they need those. There are some people working from home for part of the week. We have been able to offer that, and we're very grateful for that. So there's lots of things that we're trying to do to address those things. I think we're doing okay. I mean, 5% is challenging, but it doesn't prevent us from doing our work right now.
And then if we're low on the counselors or the mental health folks or substance use treatment people, does that result in just like longer waits for services to be delivered to people? Do people get turned away? Can you just talk about how does that impact service delivery for us?
I very much dislike wait lists. So whenever we can avoid a wait list, we really try to. If that means providing them with a lesser level of service, but just to have somebody to talk to and keep in touch with, that's what we do. So we're trying to keep in touch with people, we're also referring them. If we know of any other place that's able to help them, we don't have a problem referring them elsewhere. But we really want to not lose track of them. So at times we do have a short wait list, and or it's longer to get in. We'd like to get people in within a week, 2 weeks at the most. And when it has to be longer than that, that it's like we got to do something different than that. We do have, just so you know, we do have a same-day service. So if you came to see us today and you had a concern, a mental health or substance use concern today, we have somebody that can see you today. We have a person dedicated to at least triage and understand what it is that you need, and then try to get you plugged in to some service. We don't want people to not be able to see somebody today if that's what they need. And that service has been going on since 2014.
Thanks. And then my last question is, you've been here a while. In your experience, what would be optimal conditions, or if we had optimal conditions, what would that turnover, rate look like? I mean, I imagine with 300 employees, there's always going to, there's always people who are at different stages of their life, transitioning from here to there or whatever. Yeah. So if you could say, if everything was going smoothly, what would you think that number might be at?
Well, as I said before, 15 is what we're kind of averaging right now. My ideal would be 5. We're always going to have some people, just decide they're going to retire, decide they're going to move to lacrosse, decide that they're going to stay at home rather than work. So 5 is more easy to handle than 15.
Thank you very much.
Supervisor Powers.
Thank you, Mr. Chairman. And Dr. Tobel, I wanted to respond to something that Supervisor Sestera said, but she's out, but we'll have to tell her. When she mentioned the negative aspects of secure detention, that's not your choice. We have to pay for it, but a judge has sentenced a juvenile to go there, correct?
Yes,
it's not like we make
correct.
the decision.
We don't
in the
make the
county.
decision to place somebody in a secure setting, no.
Okay, I want to make sure. Thank you. I'll let her know.
Sure.
Supervisor Norton.
I guess my general question I could ask to anyone, Department, I ask you, Bill, and other, do we ever find out why people leave this county? I mean, is it retirement or for other reasons? Because I think we have to find out why people are leaving employment. Do we ask that when they leave?
Yes, and I think you asked that of the HR director, Mark Hobick, last night. I agreed with his answer, which was basically it's a variety. Sometimes you know why people are leaving, sometimes you don't know why. The people who are leaving for a variety of reasons, just like I said, it could be a personal reason that has nothing to do with work. It could be they're looking for more pay, and maybe the county next door is offering $3,000 to $5,000 more than what we're offering, so that's why they're going to go. Maybe it's they want to go from full-time to part-time or part-time to full-time. So there's really just a variety of reasons. There's not like one that's really coming through. I would say probably in this last year I've heard more of a reason being I'd like to work more from home. If I would say one thing that I've heard more, it's that I'd like to work more from home. Now, if we can accommodate that for the kind of job that they're doing, I would say let's look into it. But for most of our jobs, because we deal with the public and there's an expectation that we're available to the public, most of the time we really need to be in our offices and we need to be with the public, and when they come in, working from home is not an option for a lot of us.
I said this twice when I was on the Human Service Board, and I say it in front of everyone now. I think we have to do some and look at other things and can't just wait for this wage study. I think there are other reasons, and you enumerated them, Dr. Topol, of why people, what they want to stay here or why they work. They want flexibility, or they want better vacation time, or this, that, other thing. And I've asked the Personal Finance Committee to look into this in the HR department. I really wish they would. I think we need to talk to our employees, because I think employees talk to other employees in other counties and say, hey, and we have to start talking to them and see what would keep them and what would get them to recruit others to come to those counties. And it's more than just money, and I totally agree with that. And I just hope we are doing more than just that, and I hope the committee and the HR department are looking into other things. Thank you.
Supervisor Bender.
I would just say to Mike Norton, ever since Act 10 came, that's when we basically started having the employee problem. I mean, the county has basically taken away so many benefits from the county employees. You know, we used to have great health care. Now it's second rate. My wife's got the city of Oshkosh. I pay $948 a month. She's got like $750 before they pay a dime. I'm on Medicare. I pay $5 to see a doctor, you know, $50 to see a specialist. I pay nothing for my prescriptions on Medicare. And I pay $197 a month for my premium, and she pays $948. You know, the county used to have good health insurance. Then you take the retirement. You know, they gave up benefits to get the full retirement paid at one time. All of a sudden, Act 10 came, and now they have to pay for half of it. So it's like you're a family, you're 21, 22 years old, you got kids in daycare, you know, you're paying back your college loans, and the state tells you have to put 6-point-some% of your wage in a retirement account. Anywhere else, it's a 401k. If you want to add it in there, you can afford it, put it in. It's mandatory here. So even if we paid exactly the same wage, they're going to lose over 6% of their wage because it's mandatory. They go into a retirement account. We used to get basically 12 sick days a year. They took it down to 8 and included dental. Then you used to be able to save your sick days if you didn't basically use them, and you could get half of that to pay your health insurance when you're retired. They took that away, so now there's no incentive to keep your sick days. So all I've seen since I retired is a steady stream of benefits being lost. And that's why you can't keep any people, because they don't know what benefits you're going to take away from them tomorrow.
Okay, not seeing anyone else on the screen here. I thank you, Dr. Topol.
Thank you very much.
And next up, we have Parkview Health Center, Lindsay Gutsy Parish. And Parkview starts on page 408.
Hi, good afternoon, everyone. My name is Lindsay Gaska Parrish. I'm the new administrator at Parkview Health Center. I also have Doug Petrasik. Sorry, I knew I was going to mess that up, but he's our finance manager. I'm sure most of you know him. So yeah. So our budget for 2023, our revenue that we're looking at coming in is 16 million in revenue. That revenue comes from Medicare, Medicaid, private pay, VA, all sorts of different payers that we get at Parkview. I hope everybody is aware that this is the skilled nursing center for the county. So that's mostly where our revenue comes from. We do get some grants. In 2022, we did not receive that many grants. So we did have quite a bit of our fund balance that went to Parkview to cover the costs. The levy that we're asking for 2023 budget is $1,003,000. Our fund balance that we have at Parkview is going to cover about 1.9 million. Some things that we have done in 2022, one of our neighborhoods, we did transition from a locked unit to a secured unit. What does that mean, right? So that means that instead of having the doors locked, we have to have consent signed. It now has a 15-second egress, so if people were trying to leave the unit, they could still do that, whereas a locked unit, you cannot do that. So that gives us a little bit more flexibility when we're looking at admitting different types of residents that are at the hospital. We did replace the dining room flooring in the neighborhoods. We also completed construction just recently at the ancillary building. It's our new training center that's on the Parkview grounds that is going to be used for classroom meetings. There's also a garage and additional storage space that we'll be using. This will help with a CNA program
that we've applied through for the state, so we can help start training more of our workforce to become CNAs. As you know, that we are in dire need and a shortage nationwide for CNAs, certified nursing assistants. And then we also are in the midst right now of transitioning our neighborhoods to a their meal service. Right now we have these huge thermo carts that we use, which would be very expensive for us to use. So we're trying to do a more open concept dining program for the residents. So we're hoping to transition 50% of our building to that way of dining. What's that? Oh, yes, it would make it a more home-like environment. Thanks, Doug. Some other things that we're looking at doing in 2023, we're going to be completing our application for a feeding assistance program that frees up some of the certified nursing assistants so they can do more hands-on care. We can have somebody else that is helping assist the residents in eating. Right now, they would have to be a certified nursing assistant in order to do that. So we are going to be completing our application for that. We're upgrading the audio and visual system in the great room, which is our large dining activity area that we use for a lot of the events that we have for the residents. So we have a circuit network through the building, so all of the residents, if they can't leave their room for maybe they're on quarantine because they have COVID or they have something else that's going on, if there's an activity that's going on that they want to participate in, say bingo or something like that, they can turn that channel on and they can also participate. Now with the upgrades of televisions, I'm sure that you're all aware, smart TVs are the new thing. The system that we have right now does not correspond with the new smart TVs. So there's a lot of TVs that the residents aren't able to get those functions in their room. So we're going to be upgrading that, and then also upgrading the R-Care call light system. So we originally did not purchase the phones that went along with the call light system. They're not functioning the way that they should be, which alerts the CNAs if somebody has their call light on, they need assistance, if somebody's called for medical emergency. Those phones are not functioning the way that they should be, so we're looking at purchasing the phones that should have actually been purchased with that system, if that makes sense to everybody. And then also the install of the new kitchen dishwasher. Does anybody have any questions?
Supervisor Ellenberger.
Thank you, Chairman. Quick question. Why not purchase a software that goes with the telephones as opposed to the other way around? Just curious.
We have the software installed right now. We just need the appropriate phones that go with it. It would be more expensive for us to upgrade the system.
Okay, I was just curious because the way you said it sounded like one was bought, it shouldn't have been with the one and vice versa, so. Thank you.
It was kind of like we bought the generic brand, if you will.
Okay.
Yeah.
Perfect, thank you.
Sure.
Supervisor Buck.
Thank you, Mr. Chairman. I'm not sure if there was, I believe it was 2022, but maybe it was 2021, where Parkview Health Center was rated, according to Newsweek magazine, in the top 10 of nursing homes in the state of Wisconsin. Is that correct?
It is, yep.
Okay, was that 2021?
2021 and 2022.
2022,
Yes,
okay.
thank you.
Yeah, well, I think that should be under your accomplishments. I don't think anybody in this room has found the fountain of youth yet, and talking to folks throughout the community, this is something that everybody that I talk to are very proud that we're taking care of our senior population here, so thank you for your good work.
Yeah, you're welcome. Thank you.
Supervisor Challenger.
Thank you, Mr. Chairman. Hi, thanks for being here. I was wondering if you could talk to us a little bit about the relationship between staff and revenue. and some of the challenges that you've been having in filling all of your staff, and what that does for the number of beds we can have occupied, and then ultimately how that changes the revenue lines.
Sure. So because we do not have the number of staff that we need, we are having to limit the residents or admissions that we can have into the building because we need the staff, right? We got to have the staff in order to take care of the residents that are there, in order to take care of the residents of Winnebago County. So that directly affects us not having the staff, which then directly affects the revenue, because if we don't have the residents there, we don't get that revenue, whether it's from Medicare, they're coming in for a short-term rehab stay, or if they're coming in for long-term. Right now, our waiting list is 35 people. We've got 35 people on our waiting list waiting to come to Parkview, but we do not have the staff to take care of them appropriately in order to admit them at this point.
And what are some of the challenges you have for being fully staffed?
I would say part of it is the workforce. We need more people in the workforce. I think everybody would say that for all of their departments, honestly. I think part of that is I'll say specifically for CNAs. We have a lot of people, they don't want to be career CNAs anymore. They want to go on, they want to go to school, they want to be nurses. So we're always going to kind of have a little bit of a turnover with that. We're hoping that with the new ancillary building that we have a lot of, we're hiring a lot of hospitality aides who directly support the CNAs, so they do some of the hands-off things like pass water, pass linens. They can help pass meal trays, so the CNAs don't have to do that. A lot of them want to become CNAs, so we can use that ancillary building to train them to become CNAs. That's going to help us in the long run, having that building to create more of that workforce.
Thank you. Then I think my last question is, with a workforce that does, probably turn over more and whatnot than some of our other departments, do you get applicants move through the process in a competitive way?
My short answer is no.
Thank you.
Supervisor Eisen.
Thank you, Mr. Chairman. My question relates to page 417. Object 51250. Lindsay, could you explain to the county board what is the basis for a drastic increase in wage turnover savings? We've gone from 500,000 in 2022. No. Actually, it'd be 516. It'd be 51150 wage turnover savings, going from 500,000 to 1,500,000. That's a big jump. Help us to understand. I think it's probably another facet of the recruiting and turnover.
Part of this is hiring new staff at lower rates.
Please repeat that.
Hiring new staff at lower rates. We have a lot of people that have a lot of longevity, 20, 30 years, that are retiring.
So there's not there's no light at the end of the tunnel. I mean, to me, that, it looks like it's the prophet of doom.
I'm going to have Doug speak on this behalf for this question, because he helped put this together here.
All right, so when we budget labor, we budget full, all employees at Parkview working full-time. We know that the last couple of years, we've struggled with filling positions, so we know that there are vacancies that are going to happen. We projected, based on our revenue and a census, we're hoping to get to the census of 143. That's what we based our budget on. If we do that, we know that we're not going to have, our total bed count is 168, so we're down 20 just off the bat. For that, with that lower number of residents, we're projecting not to have as many employees, so that savings, basically we're projecting the savings of not having that many employees, and that's figured in that line.
Well, wouldn't it be more realistic just to drop the number of employees on the horizon, and then when conditions change, you can add them back on? That seems to be an awfully lot of money to just be floating around.
Well, that's why we took the 750,000. That's why we increased it. We knew that it was going to be, we're actually basically budgeting less labor than what a full staff would be.
Yeah, but that's the point. The point is that you're not going to be at a full staff until
But we're hoping to.
Circumstances change. Option 2, it would seem to me, would be to downsize the staff, and then as the economic cycle returns over the next 5 years, fill in the blanks. When somebody, well, you'll have enough beds. Thank you.
Yep.
Supervisor Robinson.
Thank you, Mr. Chairman. I just want to have, I'd say kudos to you and your staff. I had a son out there that just recently got released, and the care was just beyond outstanding. It's unbelievable with the short staff that you had. Your crew was just unbelievable. He was paralyzed on his whole left side. And so, and to learn how to use that left side again, you did a fantastic job. And now he's in another center getting rehab for that. And he'll probably never ever be able to he'd have to go to a home that has, accessibility for handicap. But thank you very much, and you did such a great job, and I just want to give kudos to you and your crew.
Thank you.
Supervisor Norton.
My question is, how many short staff are you right now with, I believe we have 2 neighborhoods closed, and how many short staff, or how many more staff or short staff if we had all the neighborhoods full?
Okay, so currently for the residents that we have, we would want to fill 17 positions. That's just in the nursing department. That includes CNAs and nurses. And then to have the entire building full, we're looking at 60, 70.
70. And just to inform me and reaffirming us, how many, we have a waiting list. What's the waiting list right now?
35 residents.
Thank you.
Supervisor Bender.
I know, like the city of Oshkosh, they've been sending letters to the retired employees asking if they want to come back on a part-time basis. You know, you could go back to the employees that they retired 2-3 years and mail them a letter asking them if they'd like to come back. We're understaffed, we got 35 people. Most people that are caregivers have compassion. And if they know you have a need, they might be willing to come back 16 hours a week. But what I see our county, we don't really reach out and try very hard to recruit people. We got a website that we advertise most people don't even look at the county website. And if they did, you'd have to basically find it. You know, you have to find the employment and you have to click on it. You know, it's not readily available, and we offer no bonuses. I looked at Evergreen, they offer $2,500 for an RN with 5 years experience, $5,000 for one with 10 years. They offer $500 for a CNA. They got a referral program of $500. We just think we put it on our website and these people are gonna come to us. Those days are over. So if we wanna just continue to see that nursing home shrink, and it has, you know, since basically we were 29 CNAs short about a year and a half ago, then we were 39 CNAs short, and we aren't making any progress, so we have to change the way that we do hiring. We have to get more creative, maybe we have to have more incentives, but somehow we have to serve the people of Winnebago County and give them a nursing home that they can go to when they need us.
Supervisor Cox.
Lindsay?
Hi.
Hi. I think if you're going to incentivize the people that you've got coming in, or you're going to tell them that you're going to train them, or you're going to have to find some way of incentivizing the tail end of their they're finishing their either training or their bonus or whatever. In other words, move the bonus out far enough so that you get some use out of the employee. Don't give it to them all in the first 6 months you gotta run it out a little bit. The same thing with incentivizing education. You give them a part of it, but make sure that they're gonna stick around for 3 years or 4 years, and then you'll pay them the other part. And that it'll give them an incentive to be there, but it'll also give them an incentive to stay.
Right.
Thank you.
Supervisor Ellenberger.
Thank you, Chairman. Just a quick question. Have you reached out to all the local school districts? Because I know that Neenah High School has a CNA program.
Our our nurse educator has, and then they try to attend all the job fairs that they have as well too, and at UW Oshkosh.
I thought they did, and I think the Oshkosh North also has a CNA. I'm not 100% sure, but I feel like there's more than just. But yeah, anyway, I just thought, because my daughter went through that program and the first thing she did was get a job and start working, and she was excited, and that's when you want to get them.
Right.
So thank you.
Sure.
Supervisor Powers.
Hi. Just a quick, my granddaughter's in her first year at Marquette University School of Nursing, and she did CNA work when she was in Oshkosh West, so they are doing that stuff in those high schools. Thank you.
Not seeing any other lights, I thank you very much.
Okay, thank you. Have a great afternoon.
Thank you. We'll be breaking now until 3:15, that's exactly 15 minutes, and then we'll be going to Parks, which starts on 4:46. So we'll get a 15-minute break right now.
The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. This is GovTV, opening accessibility and understanding of local government, helping you to be informed and involved. Also streaming live and on demand at oshkoshmedia.org and radio simulcast on Oshkosh FM 101.9. Like us on Facebook at our Oshkosh Media page. For a schedule of all GovTV programming, visit our website at oshkoshmedia.org. Please stay with us. Coverage will resume shortly. The Winnebago County Board is currently in a break. For a schedule of all GovTV programming, visit our website.
Some of the services we provide and some of the properties we take care of. As you can see on page 446, it kind of breaks it down. We do have parks, and those include like the community park, the Jerry Finch Winnebago County Dog Park, and Fox Crossing. We do partner with the Solid Waste Department on Ken Roble Park and the maintenance out there. We do have 7 boat landings, 3 on Lake Winnebago, 1 on the Fox River, and then 2 on Poygan and 1 on Butamore. And we operate those. We also, a lot of people may not know, we also operate 88 buoys on those same lakes, that same lake system. So we are in charge of the navigational buoys, the main navigational buoys, the big green and red buoys. We do have a few rock buoys out there as well to show danger out in the main bodies of water. We also do operate and maintain over 20 miles of recreational trail. Primarily, those are going to be the Wyowash Trail that starts in Oshkosh and ends in Hortonville. So for us, obviously, the county line at Outagamie County. And then the Mascoutin Trail on the west side of the state is 5 miles, 10 miles total. We also do have the Sunnyview Expo Center, which we host some large events such as Life Fest, the county fair. We're going to be working with Oshkosh Corporation next year on a youth program, the Baja event it's called. We obviously have a lot of horse events out there with the barns and the equestrian. And then finally, we have our nature preserves, and such as Waukau Creek, Waukau Dam. We have a historical site out in Winnebago, Lasley Point, and then a nature preserve in the town of Oshkosh, Shangri-La. So that's just our general overview. I'm not going to, read all the accomplishments, but I highlighted a few I just wanted to share. One of them, wasn't on there, and honestly, probably by mistake, because it was a big deal for our department this year, and that was our table of organization change. We made a lot of changes within our department. We created a park foreman position, so there was an avenue. I heard another department talk about it as well. I think it was airport earlier this morning. It's just another avenue, too, for our crew to have another opportunity to move up in the workplace. We completed Sunnyview Phase 1, which was the detention ponds that are out there and the extra electrical and camping parking. The Jerry Finch Winnebago County Dog Park opened. Microphone off. There we go. We opened that in May up in Fox Crossing. And we also partner a lot with facilities and highway and even solid waste. And, just want to say kudos to those departments too. We work, we're a small department. We have 9 staff, and then when we have our boat rangers, we have 11. So we definitely work hand in hand with those departments quite often, and it's been really nice to get to know them and be able to create those partnerships as well. On my way over here, County Highway was striping the 4 parking lots that were redone this year down at the county park by the soccer complex. And then actually just found out yesterday, and I know this has been a big topic, the Grumman boat landing. We just found out yesterday and made it through passive review. So we did receive the $843,000 grant from the Wisconsin DNR. So just some really exciting achievements from this year. Next year, some of our goals, we want to improve a lot of our processes. Is my second full year looking at how we work with promoters out at Sunnyview Expo and how we get more promoters out there. We will have a big project, which is every 5-year project for the Park and Rec, and that's our comprehensive outdoor rec plan. In order to apply for grants such as the one we did for Grumman, many grants require that plan, and it's a way that we go out to the community and get feedback on our park system to see which direction we should be going with our park system. So that is also our community feedback tool that we use every 5 years. You can actually see the current one on our website. It expires after next year. And then obviously next year, our goal is to finish Grumman boat landing. So just going into on page 450, just highlighting a few of the significant changes in our department. There's really nothing too big to talk about in the revenue area, other than I do want to, it's small, but for our department it's big. Justin Jager, who was part of that table of organization change, his job title changed from administrative assistant to program and marketing coordinator. He's been working with Oshkosh Rec Department, and he's also been working with PDS Fusion, which is a local running group, nonprofit, and they've fundraised $7,000 for Be Outside or Be Active, Get Outside program for 920 hours to be outside next year. So we're looking at different avenues like that to bring in revenue, and that's actually, we have some companies that are actually donating towards that program. So alternative sources of revenue are a lot of, just like the Grumman boat landing, a lot of times are the ways that we try to look at to fund some of these extra programming to get people out in the park system. From an expense standpoint, we did have a pretty big, to get to the 0%, we did have a pretty big decrease in the amount of trail work so last year we increased, and so we were doing a mile of trail work a year, and I said we have about 20 miles of trail. So this year we upped it to 3 miles so we could get done with the Wyowash Trail to Oshkosh. Next year we wanted to get out to Mascoutin. So we did decrease that expense line. Diesel fuel, as many other departments talked about with fuel and utility increases, we needed increase for that. We did have a health insurance decrease from a family to a single plan, which is very helpful. And then just some extra contractual services that we're looking to implement to try to help. We have 5 parks caretakers that take care of over 800 acres in those 20 miles of trails. So things like the roundabouts in the community park and some of those types of routine maintenance items have been difficult to keep up with, so we're looking to contract some of that out, as we already, for instance, have a contractor that helps us mow all the boat landings. So hoping to do that. And then we do our 2 ad requests for this budget year, so at the bottom of 450 is that comprehensive outdoor rec plan for $35,000 using an engineering firm that is familiar with doing those public processes and creating those reports. And then also, we have a 1997 10-foot mower, and all credit to our parks manager, Tom McGinnis, for his years of work and continuing to make sure that our equipment is updated, and really the highway as well. They, up until some, not having as many mechanics lately, they have been doing a lot of our maintenance on our equipment, and to have a mower that typically mowers last 10 to 15 years with the amount of use they get and the amount of times they get beat up with seasonal staff on them. So to have that going since 1997, we've been having some maintenance issues with that, so we're hoping to get that replaced next year as well. And then from an equipment standpoint, we also are looking to replace a truck. I'm just going to, another kudos again to Tom, because that's from 2000, has a hole in the floorboard, but it's safe, and we're still been running it. So that needs to get replaced. Really, that is the main highlights I wanted to share. And actually, on the boat landing side of things, I just wanted to at least point out that that is a special revenue account. So that one operates a little bit differently than the other 4 accounts. We started this year at $94,000 in that account, and then it rolls over. So that total at the bottom, the $1,400 for the boat landing on $460, that goes towards, and that future should go towards future fixes and improvements at the boat landing. But that's something in 2023 we'll be looking at for 2024 in terms of looking at the rates. But that's all I have to, I guess, talk about and turn over for questions.
Supervisor Gordon.
Thank you, Mr. Chairman. Adam, I was wondering, are you planning on working with any promoters as far as getting access to the Sunnyview stage? I mean, like big concerts, do we have anyone that we're working with?
That's a really good question, because last year, so I started last May, and we had hired a company from out of Iowa to come in. And actually, before my time, PMI that operates the Resch had looked at our facility and determined it just wasn't going to work for them. We also looked at, we reached out, this was a little bit before my time as well, but one promoter or one organization that does a lot of this promoting reached out and was interested. We went through the process with the county executive last year. We met with the group. They came out from Iowa several times. And at the end of the day, when it came to concert-specific events, they did not see it as an avenue in which they can make money as a private business to be able to come out and help run that.
That's disappointing.
Supervisor Eisen.
Thank you, Mr. Chairman. Adam, I'm looking at page 448, but I see nothing in your goals to accept the emergency generator scheduled for the Expo Center in the 2023 Comprehensive Improvement Plan. Is this an improvement that will enhance the Expo Center grounds?
It will. So we've been completely supportive with the emergency management department, working with them throughout the process. It is a goal in their department, and it's not that it won't provide a benefit to the expo. Purely from an expo standpoint, in terms of events in which we've lost power and those types of things, it's very minimal, maybe 2 or 3 times a year, and usually they're very short outages. We have records of that. So we definitely support it from a standpoint of it benefits the whole county, not just looking at it from a park standpoint. It's definitely a benefit to the county, but it isn't something that directly affects us for the most part with our promotions.
Yes. On a scale of 1 to 10, how integral would the emergency generator be to meet the parks and expos need to fulfill its mission, particularly when its mission is to find as a respite for disaster needs?
I would defer a little bit more to emergency management for that. I know I heard him earlier say an 8 or 9, and obviously we're, as the Parks Department as a group and as just a county as a whole and departments working together, if that's a need that he sees, I see the Sunnyview Expo from a Parks Director standpoint is an avenue in which he could absolutely, that would be a great asset to the county to be able to use it. So I would probably defer to him in terms of whether it's or how important it is towards emergency management.
And the county board too, right?
Yep.
Thank you.
Supervisor Zelmer.
Thank you, Mr. Chairman. Adam, how much does a navigational buoy cost, and do we need more in our county?
It's a good question. So 1060, let me see what page that is. It's account 1068. The buoys themselves, so we actually partnered with a group that is out of Omro. The Omro River Runners, I believe they're called. And we actually did, or the Fox River Runners, we actually partnered with them this year to purchase help purchase one buoy. So we don't service necessarily the river area. We just do the main body of the lakes, but to enter the river, there was an unsafe area, so we did purchase 2 navigational buoys, and it was about $2,000 by a time in terms of buying the buoy, getting it installed, adding chains, adding weights to it. So the 1068, and I believe, I apologize, that would be this page, so I'm looking at my notes. Our 1068 budget, it's about 60 to 70,000. Let me get to that page. So navigational aids 1068, it's about 83,100 in expenses to operate of the 88 buoys that we have, to put them out, take them out, and chase them down when they run away or repair them.
Okay, thank you.
Yep.
Supervisor Nelson.
Yeah, you touched on it. I'm trying to find it. Where would I find the income that comes in from the boat launch fees?
Good question. So that would be on page, and that we will be able to see separately through the book, because that is on page 462. And that is the account 44106. So we are anticipating 110,000 next year, and we're projected at the end of this year to be 110,000. And that's we have an annual fee, a 3-year fee, and then our daily fees.
That seems incredibly low. I'm sorry, but I just think the amount of money coming in from the boat launch fees should be way higher than that.
And we are comparable in terms of like the yearly fees and the daily fees compared to Oshkosh and Neenah and some of those local ones. But I will say we have a pretty extensive system. And if you look at a county like Brown County, we charge about $35 for our annual pass. They charge $60. So it's something that we're going to be looking into next year for next budget cycle to see where we are. And we're in a pot. So I will say, coming in, when I started in last May, we were scheduled at a deficit in our boat landing. We were negative 60,000. So this year we're scheduled to be positive 14,000, next year 1,400. But we're going to have to look at that if we're going to build that capacity to see if we can make capital projects happen within that budget.
Now, how many different boat launches are we charging fees at?
We have 7. So 3 on Winnebago, 1 in Eureka on the Fox River, and then 2 on Lake Poygan and 1 on Butamore. And they're all the same fee. So if you buy an annual pass, let's say for the county system, you get all 7. You can go on, or you could launch on all 7 of them.
I mean, I don't know that I'm totally accurate, but I thought it was close to 17,000 that Winnie County was getting on their boat launch. The county's getting half of that on 7 boat launches. I don't understand that math. Sorry.
Vice Chairman Fari.
Thank you, Mr. Chairman. My question has been answered. Thanks, Doug.
I see no other lights, so I thank you very much.
Thank you.
Next, we'll back up to UW Fox City campus with Dr. Martin Rudd, and that's on page 425. And they will be on Zoom, so they'll be up here on the big screen if you want to watch them.
Hello, everyone. Can you hear us? I'm here with Joanne Rife, Chief Facilities Officer for UW Oshkosh as well. Nice to see you all. Again, we were in front of you not that long ago to talk about our 2022 capital projects. We're here to talk about the operational budget, which is on page 424. You can see my narrative that I provided for the report, including our 2022 accomplishments and some of the 2023 goals. A couple of things to note on there. We're really moving towards the final pieces of UWO's strategic plan, and our Board of Trustees previewed that at their last meeting when they had a visit from Chancellor Andy Levitt, UW Oshkosh's Chancellor, who came to the trustees meeting. So we'll be looking forward to 2023 when we'll be able to fully implement that strategic plan, which focuses on innovation, student success, and community activities. A couple of highlights for you as well. We are making great progress on the county's funded project for the University Children's Center addition that we hope to have finished probably within the next month. We had the storm doors and windows arrive, I guess, ahead of the delayed schedule, if there's such a thing, earlier this week. So those are now in, and we will hopefully have an official opening for that facility early in the new year, probably coinciding with the beginning of the spring semester.
Recording in progress.
Remember, we come in front of you today with our operational budget, which doesn't include any personnel. These are operational dollars for the maintenance and upkeep of the UWO Fox Cities campus. The portion that you see in front of you is the shared portion, the other half being covered by Allegheny County. I would entertain any questions.
See no questions? Well, here's one. Supervisor Defferding.
Thank you, Mr. Chair. This is, I'll just kind of repeat a question that I provided before is, what's the current enrollment numbers from 2019 up until projected into 2023?
So our current enrollment number for this year is 600, and I'll add my caveat to that in just a minute. Last year it was 714. So those are headcount numbers only. They don't include two specific types of population that we are seeing as a result of our one university model. The first portion of those is we do not include the students who are taking classes with us from local high schools on the campus or that are connected with us remotely. Those are included in UW Oshkosh's overall enrollment numbers for their Cooperative Academic Partnership Program, CAP. We don't break those out by the specific campus at which the students are attending. The second caveat to that is that our one university model, which provides curriculum across all three campuses, has several hundred, and those numbers were provided to the trustees, upwards of 380 students who swirl around the campuses. So an additional 380 students who are coming to the Fox Cities campus to take classes, but whose home campus is not the Fox Cities campus. So that is, they may have declared Fond du Lac or the Oshkosh campus as their home campus. Again, the curriculum that we are building is designed to bring students to the place and the modality and the convenience that is best for them to complete their associate's degree and then their baccalaureate degree. And that best serves placebound students and students who are mobile between our three locations, including online.
Thank you.
Thank you for the question.
Vice Chairman Fari.
Thank you, Mr. Chairman. Can you hear me, sir?
Yes.
My question is, this Fox Cities campus budget, is this, obviously we pay for capital improvements, capital projects. The state pays for wages, salaries, correct, for your employees?
All correct, yes.
What I'm seeing here is a maintenance issue primarily, correct?
This is a budget for upkeep, annual upkeep and maintenance of the campus. That's correct, Joanne?
And is that shared with Outagamie County?
Yes, so their portion that we request from them and that's been approved is exactly the same as the portion that's seen here. And there has been no increase in this over the last 6 years.
Okay, so what we're seeing is our share
Yes,
of
sir, that's
that
correct.
commitment. So it's actually double this in reality.
Yes, that's right. About
What you're-
300,000.
Can I correct that, please? So the revenue that you see in the budget on page 431 actually shows the revenue that is Outagamie County's share. So the tax levy that we're having to, that you see for the Winnebago County budget is the $148,624, which is just slightly less than half of the total expenditures for the operating budget.
Which is at 307,616.
Correct.
So I see. So your Outagamie County, their share is shown by revenue.
Correct.
On our document. Thank you very much.
Yes.
Not seeing any other questions? I thank you very much.
Thank you.
That's all we have for today. Thank you. Let's see, next we'll go to Register of Deeds. Natalie Strohmeyer. It starts on page 457.
Okay, for the people that don't know me, I am Natalie Strohmeyer. Our office basically is an office that is set by state statute. We handle the recording of real estate documents and handling of vital records. This last year, the first part of the year, we were extremely busy with the real estate documents since the interest rates have risen. We have slowed down. Our vital records are still staying pretty consistent, especially now that the marriage records have gotten more convenient, that they can file their marriage certificates in any county, not just having to file them in Winnebago County, which makes it more convenient for the people that have gotten married, that they can go to any county to file them, which we have gotten a lot more business from that, which is nice. So between birth, death, and marriage, it makes it more convenient for everyone. And not everyone knows that, but the word does get out, and it's nice. Then they come in and they say, oh, I wasn't born here. And we say, oh, we can still help you. So it's nice when they hear that we can help them more. So it's nice to be able to help the people when they come in. We are short one staff member. We're hoping to get somebody, but it's been hard to recruit when the 3 counties around us are paying between $2 and $3 more an hour for the same positions for our lower staff person. So again, I'm hoping with the study that our office gets boosted quite a bit, because that's one of the things my staff says is, can you do anything to get our wages raised? I'm like, I've been trying for the last couple of years. They keep on saying, hang on for the study. So I am hoping that with this study, which I have not heard from any consultants yet, but I'm still waiting. So hopefully sooner or later, someone will get hold of me for that. As far as the levy goes, I have met my target, plus I've given like an extra 6,000 back. So I guess I'm going to leave it up to questions if anyone has any.
You must have done a good job, because I see no questions, so
I appreciate that. I like that when I have no questions.
I thank you.
Makes that easy, especially when my heart's in AFib right now, so I appreciate no questions.
Thank you much. Next is Planning and Property Lister, Jerry Bougie. Planning and zoning starts on page 475.
Good afternoon, everyone. Jerry's an old timer. He's been through this a few times. I also have Adam Dorn, our GIS administrator, with us. More to talk about any land records GIS stuff, if that comes up. Yeah, I guess our budget starts at 475, page 475. We basically have, you know, the planning and zoning department is made up of 4 divisions. We have planning, zoning, there's GIS, which is Geographic Information Systems, and property listing. And on the planning and zoning side of things, you know, we mainly deal with a lot of state mandated requirements, everything from shoreline zoning, floodplain, wetland, those kinds of things. So we do, and then the planning side of stuff, we got a comprehensive plan that's state mandated and a farmland preservation plan that's also state mandated. So we deal with a lot of state mandated programs. On page 475, you'll just see some of the general services that we do provide: land use planning, subdivision review, the zoning, stormwater, erosion control, GIS, land records modernization, property listing, and we also provide economic development services for the county. So we work with a lot of local communities regarding that. For our budget, regarding our budget, for the big changes starting on page 480, really the big change is we do anticipate or propose some revenue increase through some increase in zoning permit fees and also fees for the pouch maintenance fee. And some additional transfer, some dollars from the Land Records Modernization Fund, which is a non-levy fund. We're able to move that over into GIS to offset some of the GIS revenue, the GIS expenses. So, given that, we did on a net change reduce some expenses about $4,100. So we are able to come in with a flat budget. One other point, we are proposing in the budget to upgrade a current code enforcement officer position to an assistant zoning administrator position. That would basically is designed to provide backup in the office when the zoning administrator is unavailable. It'll also provide better service to the public and to the office overall. And it's also a retention issue. We have a lot of good people that come through the office as code enforcement officers in the past, and it's been, it's been a revolving door. We work with them, train them, stay with us for a while, and then they move on to other counties, essentially, because of better opportunities. This way it provides an additional way for some growth, I guess, in the department, so we can, hopefully hang on to people, good employees. So that's really it in a nutshell. Any questions?
Supervisor Eisen.
Thank you, Mr. Chairman. The question I have, Mr. Bougie, reflects upon an impact on the planning and zoning activities. The Judiciary and Public Safety Committee is examining a consent calendar in which multiple reports and resolutions would be approved in mass. Is there any planning and zoning objection to treating these actions in mass? And planning and zoning, Judiciary meets Monday, November 7th at 6 p.m. at the Law Enforcement Center.
Yeah, my response.
Any comment?
I'm not sure what that is about. I'm unfamiliar with that.
Okay, perhaps the chairman, who has been a long time planning and zoning aficionado, would be able to comment on that. You're certainly invited to the Judiciary Committee's consideration.
Unless I'm confusing with something else, I don't know.
I can talk to him afterwards about it if you want to, Supervisor Eisen. Make sure that we've got everything down and so he knows the date and why you would like to have him there. So
Yeah.
I'm not chairman of that committee anymore, but I'll be more than happy to do that.
Okay.
Thank you.
I'll watch the video playback.
Vice Chairman Fari.
Thank you, Mr. Chairman. Jerry, in reading the change to add a full-time assistant zoning administrator,
Right.
is that a training opportunity for our current zoning administrator?
It's a,
Think about my question. Is that a training opportunity for our current zoning administrator?
we're getting there, yes.
Yeah, okay, very good.
That is in the mix.
Thanks.
We are taking, that is part of the consideration, yes.
That was my assumption when I read it. Thank you.
Thank you.
Not seeing any other questions. I thank you. Do you have any other part for it, or is that all you have?
Yeah, we have the Land Records Modernization Fund also that starts on page, page 492, and that fund is basically a off the levy. It's a fund that's funded by recording fees in the Register of Deeds office. This particular fund receives $8 of every $30 that's recorded in the Register of Deeds office. And it's all designed, it's all a state program that counties operate, and it's designed to really keep our GIS equipment up, and not only for our department, but for other departments as well. So it's shared with other departments such as Register of Deeds and Treasurers, just for an example, and Land and Water and so forth. So that fund is really a non-levy item. Are there any questions on that?
Vice Chairman Fari.
Thank you, Mr. Chairman. Just a comment. Of course, I've used the GIS system many times during my career. And for those that haven't used it, if you know the parcel number of a particular piece of property, you can go online and get all kinds of public information on that parcel. So I'm told that we have one of the best systems in the state. We have a really good system here, so
Yeah,
we applaud you for that.
Yeah, I really applaud the.
Well done.
The county and the county board to continue supporting that. It's been proven to be very, successful, and other counties look to our county for guidance, for issues and funding and things like that, so.
Yeah, it's
Thank
really
you.
nice. I would also include off the record, I own some property in South Dakota, and they don't even hold a candle to what we got here, so. it's really well done.
Thank you.
Not seeing any other questions, I thank you very much.
Thank you.
Next is Land and Water Conservation, Chad Casper. And that begins on page 499.
Okay, good afternoon, everyone. My name again is Chad Casper, the Director of Land and Water. This would be my third budget, first one in person. So for those supervisors that don't know a lot about our department, I'm just going to kind of go over some of the basic things that we do within Land and Water. So as our mission statement states, we provide a full range of professional services in the planning, design, and implementation of programs and projects that protect, restore, and sustain the natural resources of Winnebago County. So through our department, we administer state-mandated agricultural performance standards. So we work with farmers throughout the county to get them in compliance with these standards. That may be working with runoff on their cropland, or it might be working with their barnyard to make sure manure isn't ending up in waters of the state. So we work with them on those issues throughout the county. We also work on the farmland preservation program. So we work with farmers in one township to get them in compliance so they're able to take their tax credit each year. We also participate in the multi-discharger variance program. So what that is we participate each year to get funds from different wastewater treatment plants within the region. So if they can't meet their targets for their pollutant for the discharge going into the water bodies, they offset that by giving our department funds to work in the watershed to work with farmers to get the pollutant reductions that we need. So there's quite a few funds that have been coming through our department with that program. We administer the Conservation Reserve Enhancement Program in cooperation with the USDA and Department of Ag. That's a buffer program. We put buffers along streams. We have a livestock waste management ordinance where we are responsible for issuing permits for all livestock facilities and livestock lots. We also oversee the construction of manure storage pits or the abandonment of them. So the goal of that is to make sure that we're meeting setbacks with surface water and also groundwater with these manure storages that do go in. We make sure there's setbacks from bedrock, from groundwater, and then we oversee the rebar, the concrete, to make sure it doesn't leak into our groundwater system. So we're busy with that. We have a multitude of different grants in our department, from local, state, and federal grants. So there's multiple grants that we administer, and these grants provide financial assistance to landowners throughout the county, and that may be for cost sharing on different projects. It might be working with a farmer on a barnyard runoff control system, or a grass waterway, or maybe a wetland restoration. And another day it might be working on the lakes. We're a leader, I would say, in the whole state, if not the region, for offshore breakwall projects. We've done over 6 miles of breakwalls we design right in our office and install in winter, and those projects restore hundreds and hundreds of acres of wetlands that have been lost over the years. We do native shoreline buffers as well on the lakes. And again, all these projects, we have cost sharing with these grants that we're able to provide. We also work with farmers on nutrient management plans, and we're working with farmers to implement what's called soil health initiatives. That's a big push in our department right now to get away from your traditional mower plow, working that ground over and over. We want to keep a living cover on that ground year round. It creates a healthier soil. It keeps the soil in place, and it retains more water. There's just tons of value to that, but it's an educational curve that we're working really hard within our department to start changing that transition to a different management change within the county. At the end of the day, though, our department, everything we do is to improve and protect the groundwater and the surface water resources of Winnebago County. And as you all know, we're tremendously fortunate to have the Winnebago system right in our backyard. We have more surface water than any other county in the entire state, so it's a gem right in our backyard that we want to protect. So I'm just going to go over just a few budget items here, just to get you all educated on some of the larger items on page 504. It would be the account 42004. That would be Agri Trade Consumer Protection. And what this is we have to, it's state mandated that we develop a 10-year land and water resource management plan for our department. This was done in 2001. It'll be updated in 5 years. And what that does is it opens up the door for funding with the Department of Ag for our department. So There's about $115,000 of practice money in there to work with farmers, and then there's also about $186,000 in there for staffing for my department. And then if you slide down to 42019, other grantor agencies, this revenue account is a handful of different grants that we have. I mentioned the MDV program. There's 2 grants in there that we got for soil health initiatives in the county. And then there's a grant in there, it's called the NRDA grant that came from the PCB cleanup on the Fox River. I applied for a grant for 2 breakwall projects on Lake Winnebago. So there's some funds still in there. And then if you turn to page 507, account 53565, operating grants. These are the expense accounts. So in here we have all the grants I just mentioned in the expense account, and we also have the local county water quality improvement program. We get about $87,000 to $100,000 a year of local levy, which has been invaluable. We use those local funds as seed money when we write for grants to use as in-kind match, and we can leverage a lot of other money for our department. So it's been really helpful to have those funds. And then the last accounts, just to have you look at, would be on page 508, 55030, other contracted services. There was a decrease in this account due to, we established a plat book for the county. We put it together this year in 2022, so there were some publishing costs with that we won't have in 23. And we also administer the wildlife damage claims and abatement program, and they have a new staff in that organization that's new and it's lower wages, so that number went down. The remaining $20,000 would be for the Winnebago Waterways Program. That's where we have an intergovernmental agreement with Calumet County and Fond du Lac County and us, and now Waushara County just approved it at their county board in October. It's a great program where we leverage funds. We got a lake management plan approved for the entire Winnebago system. We have watershed plans approved, and it's just opening up the door to funding and really focusing our efforts at a regional level. And the last thing would be just a couple of the other significant changes I want to point out. Health insurance, we had a decrease of about $15,500 that was due to the new watershed specialist position that we anticipated going on a family plan. They chose a single plan. There was some nice savings there. And then the $87,967, this was a position that was it was approved at the as an amendment at the county board sessions for 2022. So that money was taken out of the general fund undesignated fund balance initially for 2022, and that was reflected to increase my levy this year to be able to cover that position that was approved. And then the last thing I had is we have a 2003 truck we're looking to replace. 2003 F-150 that we have $39,000 in there, and it's appreciated that it was put in here as a general fund balance because $39,000 in a small budget like mine would be really hard to find that money without making major cuts. So that's why it was structured that way, and I would entertain any questions.
Supervisor Defferding.
Thank you, Mr. Chair. I went to your or to the presentation regarding the breakwall project along Winnebago in that area there. So it sounds like that has that actually started, or is that still in process?
Okay, are you talking? We have 2 breakwalls in Winnebago, and then we have a big one on Butamore, the Sammers Bay Terrells Island project. Are you referring to the 2 smaller projects?
The 2 smaller ones. Yeah.
Okay. Yep. One was completed winter of 2020, and then this last winter we finished, I would say, 99% of that breakwall. You can see it from the Winnie County Bridge looking north.
Mm-hmm.
And because of the Wolf River currents, it was getting dangerous to do equipment, and then I got a bid to barge in. I have about 50 feet left that I wanted to get done, and the price was astronomical. So we decided to close the project out, call it a success, and they're both done and complete. So
okay.
Yep.
And so I guess looking forward, is there going to be like further studies of the effects of the breakwall?
Definitely, yep. So there's a few things going on. We are doing, part of the grants that I applied for, we're doing monitoring. We take the drone and we do flights. We can take hundreds of pictures with a drone, merge them all together, and it's clear enough where we're able to see the species and the size of the plant beds and how they expand. So that's part of the monitoring. And then we're doing, they're called Secchi disc readings for water clarity, and then we're doing submergent plant sampling as well. We do it once every 3 years. We're doing that for a number of years. And there's also a study being done through the Winnebago Waterways program with UWO to monitor the effectiveness of break walls. They're essentially doing a study on how the break walls, how effective they are. And I'm glad we're doing more monitoring. It's something we haven't done in past years. I can tell you that there's tons of good plants. You can see crystal clear water, and visually it looks great, but to have the science behind it moving forward is going to be helpful for grant writing.
Yeah, and from your opinion, I mean, has it affected like boat traffic at all? I mean,
We, when we look at these, we take that into account for safety. So I work with DNR. We have a team that we look at this, and I feel like we place them out of those zones where there is traffic for that reason.
Okay.
So, yeah.
Excellent. Thank you. And one other question too is, obviously, it's kind of a long project in regards to blue-green algae along in the lakes here. You know, I kind of live nearby Lake Winnebago. I live in Neenah, so it still is an issue. You know, we still see it like once every, usually in July and August. Just give me like a projection of how that's coming along and your role in that.
Yeah, so I mean, it's a eutrophic system. It's a shallow lake. Going back, I was just at a meeting at UWO. They talked about the blue-green algae going way back, even in the historical documents that they looked at. So we're working with the university. It's a lot of education. They're looking to get a system in place where we can hopefully start to educate the public when there's outbreaks of these. So I think that's a big part of it, and then just keep doing what we're doing. I mean, there's a huge watershed. It's like 5,700 square miles, and there's a lot of what they call legacy phosphorus in the bottom of these lakes. So it's tied to the sediment into the bottom of the lakes. And as that wave action and the boat action, it stirs that up, and there's a lot of phosphorus that needs to get taken up, and it is going to take time. This isn't going to happen overnight. That's the neat thing with these break walls is it takes up a lot of those nutrients with the plants, and it's clearing that water up. So it's just a multi-prong approach with break walls, working with the farmers. It's just going to take time though, but we'll keep chipping away and see where it goes.
Thank you.
You're welcome.
Supervisor Powers.
Thank you, Mr. Chairman. I was just wondering, I'm hearing a lot about red swamp crayfish invading Wisconsin waterways from the south. And when you have an invasive species that comes in, how does that affect your budget? How bad is this situation with these red swamp crayfish?
I'm not totally familiar with that, but we do. I just actually filled out paperwork through Fox Wolf Watershed Alliance. So we get a small amount of money through the DNR for aquatic invasive species efforts. There's multiple counties that give that to Fox Wolf to try educational and then outbreaks. They try to prevent this. So there's definitely efforts that are being made. But it can be counteractive. I know some of the things out there, it can be detrimental to some of the work that we do. I'm not familiar with the crayfish, so I don't know enough about that to speak on behalf of that, though.
Okay, thank you.
Yep.
Supervisor Horan.
I just want to thank you so much, Chad, for teaching me what I've been learning. It's just that being on this county board has definitely gotten me out of my comfort zone, and to be a part of the Land and Water Committee has said, here's a home. So I thank you very much. And watching what the drone does is just a blast. And apparently they have to let anybody who might be out sunbathing know that the drone is in the area. Thank you.
Supervisor Nelson.
Yes, I've owned and operated a business right close to where that break wall is for the last 50 years, and I watched that cane bed gradually disappear and go to nothing. And with that break wall in place now, within a year, I've already seen from my picture window all of the improvements there. So, and as far as it impeding boat traffic, all it's done is stop the really inexperienced boaters from running aground in the weeds and the muck. So it keeps them in the river where they belong. So congratulations on a great project.
Thank you. It was pretty amazing. We flew the drone over it, and like I said, we finished it this winter, and to see It gets to be a really dark color with the drone when you see the aerial photo, and you can already see the clear water and the submergent plants already responding behind that break wall. And a friend of mine sent me some pictures of some nice smallmouth bass that they're getting along that break wall now too, so it's great for fisheries as well.
I see no other calls, so I thank you very much.
Thank you.
At this time, I'm going to call up John Robbie for solid waste. And we'll save ours to last.
What's done for me. Yep. We do have a drone out there that.
5:59 it starts on.
Yeah, good afternoon. For the new people on the board, I'm John Raby. I'm the Solid Waste Director for Winnebago County. We're charged with operating a solid waste and recycling facility that services our municipal partners, our businesses, and residents in Winnebago County. Oversight of the department is provided by the county executive and our 9-member solid waste management board. We operate a little differently than maybe some of the other departments as a quasi-independent enterprise fund where all our operations are offset by user fees or tipping fees that we charge for services. So there's no direct impact on the tax levy for the solid waste department. One other interesting thing is we formed a regional partnership back in 2003 with Brown and Outagamie County, kind of pooling our landfill and recycling resources. And we've been operating under that guise since that time. In 2020, we were able to negotiate an extension and amendment to the solid waste agreement, which now provides disposal services for our Winnebago County residents through 2042. So that was a big accomplishment for us. The landfills that we have at Winnebago County have been filled and are closed now, so we're maintaining closed landfills. And we operate a drop-off site for residents and businesses, as well as a transfer station for both solid waste and recyclable materials. Those materials that are run through our transfer station are then hauled to both the Brown and Outagamie County landfill for disposal, for the waste side of things, and then for the Tri-County recycling facility in Outagamie County for our curbside collected recyclables, where they're processed. Some key highlights of the budget. One item is we're adding one solid waste equipment operator. So we're going to from 16 to 17 full-time employees. And that labor and benefits have been added to the 2023 budget, I'm sorry. Our tipping fee for solid waste is being increased by $4 a ton. We're going from a gate rate, what we call just our printed rate, from $48 a ton to $52 a ton. Whereas our recycling tipping fee for our municipalities is staying the same at $5 a ton. One of the biggest challenges that we had this year, in addition to staffing and some employee turnover, was we realized that we're running into a transition year. We've known about this for quite a period of time. There's two things that are kind of in play. The biggest one of the two is our 15-year power purchase agreement with WPS is coming to the end in 2022 here. The markets and rates that they're willing to pay in 2023 and beyond are well reduced compared to what they've been for the last 15 years. So that is a big challenge. And in one of the line items for power sales, you'll see a reduction of $1.12 million in power sales revenues. So we're looking to extend a PPA or power purchase agreement with WPS in 2023, and then look at other options for the renewable attribute side of gas generating electricity from landfill gas. To determine if that's going to be sustainable long term, or do we just look to flare the landfill gas? And I know our solid waste board really would like to avoid doing that if we can make it work. We've got increased labor and benefits by about $75,000 because of the new equipment operator that we're adding to our table of organization. The other big item is we're also entering a more expensive phase of our regional landfilling plan. As part of the amended and extended agreement in 2020 that we entered into with Brown and Outagamie, Brown County has now opened their landfill. And so we're now running 2 large landfills at Outagamie and Brown, and so we're sending waste materials to both those facilities. So operating costs are a little bit higher, and then subsequently getting the waste to these landfills has gotten more expensive as fuel costs have gone up and the distances have changed. So the way our budget sits right now is we're showing a $1.5 million deficit, but it was planned. We have retained earnings that we've set aside over the years from operating efficiently in our power purchase agreement. So the deficit is going to be offset for 2023 with those retained earnings funds. So with that, I'd open it up to any questions you might have.
Supervisor Albrecht.
I just want to tell the board that Winnebago County shouldn't use the word cheapest trash disposal of anybody in the state.
Yeah, as part of the regional agreement that we entered into with Brown and Outagamie, it's allowed us to realize efficiencies from economies of scale. Instead of running 3 small landfills with higher tipping fees, we've been able to run 1 large landfill or 2 large landfills at a time to gain some efficiencies in that regard. So we're typically 20% lower than the statewide average, maybe even a little better than that. So.
Supervisor Norton.
Thank you. I have a question I always want to know. Who decides on the tipping fees?
Who decides on the tipping fees? Well, that is something that I come up with and recommend to our solid waste management board. They provide some feedback, and then we bring the budget with the tipping fees to the county executive. And it was one thing that we discussed during our executive budget meeting, that maybe we need to look at even a little bit more of an increase than what I had originally proposed.
So I guess either you can answer it or the Corporation Council. This board doesn't directly approve of that. Am I correct? Either one of you, the Corporation Council or you, Mr. Robbie.
Yeah, it's not something that the board has typically commented on or approved in the past. It's been handled with our solid waste management board and then with the blessing of the county executive.
I guess I would like to, you or Corporation Council explain to me why that is. And my second follow-up question is that how other solid waste boards around the state operate.
Well, I guess in our 3 county partnership, Winnebago County is a little different, operated a little differently than the other 2 counties. Brown County is a solid waste board, but they are tied to county board for some of their approvals, whereas Outagamie County operates with a highway and solid waste committee, and so they have to go through the process with county board for all their budget and policy decisions. So
I guess I'm going to reiterate, I'd like to have explanation. You don't give it to me today, but I've always wondered that, and maybe some of our citizens would like to know that too. My second question, you have a large reserve, don't you? And where is that shown in here? Can I ask that?
We do have a large retained earnings. The balance at the end of 2021 was around $34.5 million. It is in a segregated area and invested with the rest of the general fund dollars, but it's marked for solid waste reserve funds.
And I'll ask the question, is that how the other solid waste boards operate in this county? And you can give the example of both Brown and Outagamie, which we are partnered with.
Yeah, both Brown and Outagamie have similar retained earnings funds that are handled that same way, that are separated, earmarked for solid waste, but invested with the general fund pool.
Okay, thank you.
I see no other lights, so I thank you very much.
Thank you very much.
And last but not least is county board's budget. It was also my first one, I can tell you also. Be patient with me. But thank goodness I had the lady that's had 40 years' experience helping me out do this also. If there's any questions, she might have to help me out here. It's pretty self-explanatory. I'm sure most of you have read it by now. If you have any questions, you can... Any questions? Or- Supervisor Norton, it starts on page 511.
Very quick question. Someone asked, who decided not to fund the scholarship program at $9,000 that I think we've given up every year for the last 20 whatever years?
Who decided what?
Who decided not to allocate $9,000 to the scholarship fund, which I believe we've allocated that amount the last 22 years I've been on this board?
Well, I talked to the county executive, and it's not that we're not giving the $9,000. It's just that it's not coming out of that levy or whatever. That's all that it is. So the $9,000 is still in the budget. It's just where it's going to be coming out of. Supervisor Powers.
Thank you, Mr. Chairman. The county scholarship committee has met, will present a resolution at the November meeting, and I am proposing that we put the levy back in to the line item, so it's $9,000, plus we take $9,000 from the reserve that's been held for the county scholarship, making that line item $18,000. So we're still getting the levy, but we're also at the same time sizing down some of that reserve.
But you've got that into a resolution or whatever, correct?
There is one.
Okay, thank you. Anyone else have any questions? Otherwise, I think it's all pretty self-explanatory. Supervisor Dowling, I know you don't have your light on, but I heard you ask a question.
I was just curious to know which line Supervisor Norton was referring to. I didn't catch it.
On page 513, which is the county is not giving a tax levy for the scholarship program for 2023.
But again, that isn't what it was supposed to mean. It was supposed to mean that we're just not taking it out of there, that it would come out of the proceeds that are already in there. Because there is, Mike, can you say how much is in? You should be on.
Conked out a little while ago. All right, thank you. The scholarship fund is a separate designated fund within the general fund. It's got a little over $42,000 now, and at the executive budget meeting regarding the county board budget, we discussed that and why the fund had just been growing, and we were putting in tax levy every year for the 9,000 scholarships rather than using the fund balance. So we decided to put it in the budget as a use of the existing fund balance, but to have the same expense line of $9,000, and that's what's currently in the budget.
Supervisor Powers.
Yes. The tax levy that represents 0.00005% of the county budget. 1/100,000th of the budget. That's why I'm pressing to have this go back in, so that we can continue, so we won't lose that levy money in future, and at the same time, take money from the reserve so we can begin siphoning that down. Thank you.
Any other questions on it? Not seeing any. I guess I got it away as easy as anybody. Either that or you're all tired. Well, we made it through the book, and that's what the goal was today, was get through the book. So tomorrow, we will go ahead, and I think there's probably a dozen resolutions or whatever or so, just approximately, that we'll go through.
Well, I currently have 10, so if any board members would like to submit additional, there's certainly still that opportunity. There's some, where are these yellow forms up here? I'll bring some more tomorrow if we need any, or you can fill out the electronic version, which was emailed out. If you'd like to consult with any of the department heads present, well, I, for one, I'll stay around here a little while. If you have any amendments you'd like to discuss with me, or if you'd like to show me a draft, and I can look at the numbers and see whether we have the right account numbers on what you've drafted. Otherwise, we can take care of some tomorrow morning as well.
So unless there's any questions, Supervisor Albrecht, we're ready for a recess.
Move to reconvene tomorrow at 8:30.
Is there a second? Did I hear a second? Well, we got a question here by Supervisor Norton.
Can I amend that? Because I was going to make a motion to meet at 6 o'clock tomorrow night.
Well, do you have a second? No. Dies of a second. Dies a second, so. Okay, so the dies of a second. Don't everybody get excited, as long as you don't second it. If you wanted it, you should second it. Okay, so the motion on the floor is that we'll reconvene until 8:30 tomorrow morning. All those in favor signify by saying aye. Aye. Those opposed say nay. Carried. We are recessed.